I know almost everybody here, but I'm Kristen. I'm the student here, and today's my last day. So I'm going to be looking at Danielle's shoulder. Feel free to ask questions. You won't embarrass me, maybe a little bit. But I took a little look at her and asked her history just to make sure that she did have a shoulder problem, and I was hoping that it would be a little bit more straightforward, and she confused me a little bit, so we'll see how this goes. But Danielle, how long have you had your shoulder pain? August. And she said it's like in the front and on the side. And she's gotten a little bit of PT for it before, and it helps when she does her exercises, but she hasn't been doing her exercises. And moving, I think that's aggravated it a little bit as well. So she's been working on putting herself in a better posture, some rotator cuff strengthening as well. She said that the prone exercises, the Y's and the T's, were aggravating it. Just based on that information and her alignment, I was kind of thinking that she had the MSI diagnosis of an anterior humeral glide. Just from being in this position, the swimming too, looking, this is a little bit back. So any questions to start off with that? All right, I'll start with just looking at her alignment. So from the back, do you want to face this direction? Can I put your little hair in a bun? Look at you. Okay. So look up to the ceiling for me. Okay. And then look straight ahead. Okay. So right now I'm looking for T3. So C7, T1, T3, right about there. Just to see if she's depressed more. That's one of the landmarks. So we look at depression from 3 points of view. So whether there's an increased slope, which she's higher on this side. But then I just want to double check by looking at this root of the spine on both sides. And so she's actually lower. So the root's lower on that side. But she looks a little bit elevated there. And then now I look to see if she's abducted or not. So greater than 3 inches we consider abducted. So I'm going to get right behind you. So she's definitely a little bit more abducted on that left side than the right side. And then now I'm going to check for her rotation. Let me know if it's tender wherever I'm pressing too. You'll scream in pain. So slightly downwardly rotated on the left side. And then on the right side, she has a little bit of upward rotation. And then just looking at her, sorry, my hands are still a little bit cold. I try to put them over the heat packs. But she looks like she's tipped forward a little bit anteriorly as well. From the side, I'm going to look to see where her humeral head is sitting. Here, do you want to face this way? So I would say she's definitely sitting a little bit more anteriorly, just a little bit, just a tad, which goes along with my working diagnosis. And then coming down here, she's in a little bit of extension, but not too bad. I think she was actually worse the other day when I looked at her. So now I'm also going to look to see. She's in a little bit of humeral medial rotation, so I'm going to correct her scapula and see if that makes a difference on her humeral position. So go ahead and just relax. So she's still medially rotated, which is fine. Okay. And how are you feeling right now? Okay, let me check your other side, so turn around this direction. just to see. So she's definitely sitting further on the other side anteriorly. And then she's also in less extension on this side as well. Any questions? Yeah, less medial rotation too. And then now from the front, one last check. So this is the third way that we check for the depression. So there it's upwardly sloped. And then this one's higher. So far I think the biggest thing that I'm seeing is she's anteriorly tilted a little bit. She's abducted. Her humerus is resting in medial rotation and slightly extended, and she has that anterior humeral position. And she also has some downward rotation as well. So now she's going to face back this way. Just keep turning her around. This is also when I evaluate people, I'm like, sit up, stand, go back down. Okay, so raise both of your arms up overhead. Okay, any pain with that? And then come back right there. Okay, and then come back down. And a little bit click on the bottom. Okay, so do that one more time for me. So the first time I checked to see if she got enough elevation, and she looked like she was about equal to C7. Try that one more time. So she's actually lower, I would say. And then she's not quite getting enough upward rotation either. And then come back down. And still the same pain on the way back down. Okay, so first let's try fixing, because she's going up in the medial rotation, so try pointing your thumb up to the ceiling and then going up. Does that make any difference on the way up? A bit? Better, worse, or the same? Better, and then come back down. Any difference on the way down?
Less popping.
Less popping, good, okay. So I'm going to try a couple more things. So now try pointing your thumb up to the ceiling, and then as you go up, kind of let your shoulder come up a little bit. So kind of shrug a little bit on the way up. So now start to shrug just a little bit. How does that feel? And then come back down. No popping, so better that time? Okay. Do you want to explain it?
Loud pop, the pain comes. When it does a minimal pop, not as much. It's mainly the traction here, but when it does a really loud snap, then the pain comes in right after.
Okay, now I'm going to stick my cold hands under your arm. I'm sorry. So just relax. So now lead with your thumb, and I'm going to give her a little bit of upward rotation and see if that feels any better. Okay, so go ahead and go up. And then come back down. And that popped on both ways. Okay, so far fixing the medial rotation and then having her elevate as she comes up, that seemed to decrease her symptoms, but giving her the upward rotation actually gave her some popping. So let me try it with a little bit of elevation. So you shrug. So relax a little bit, sorry. And as you go up with your thumb, go ahead and do a little shrug on this side. And still. Okay, and then come back down. And come back down. You okay? Mm-hmm. Okay, so squeeze back here a little bit. Squeeze. There you go. Okay, now do the same thing. Come up. And then come back down. Still. Okay, so far the best combination is just the thumb up and the shrugging. Okay, so go ahead and sit down for me. Actually, keep standing up. Sorry. Second thought. Go ahead and go out to the side and lift your hands up overhead. Yeah. Okay. Any discomfort with that? No? And then come back down. What about on the way down? Nothing? Okay. So now what I want you to do is bring your arm out to the side. Okay, and then come back. Do that one more time. Okay, and then come back. Any pain with that or discomfort? A little bit. Try squeezing your shoulder blades together a little bit. There you go, and then going out to the side. Better? Better? Okay. Good. So I noticed when she did the lateral rotation, she was kind of coming forward just a little bit up in the front. And then this, she was also kind of internally rotating just a little bit. Her inferior angle was moving, so stabilizing her scapula and getting her elbow in a little bit better position. So go ahead and squeeze together again and try that one more time. And better. Okay, come back. That looks better. Okay, good. First lesson learned. Go ahead and sit down right here for me. So now I just kind of want to test to see her serratus and if she can get, because I don't like that you don't get the full upward rotation. So sorry, now I'm testing her serratus anterior. So go ahead. So right here. So just relax for me. Relax your arm in my hand. Good. Well, any pain with this? No? Can you hold right there for me? Okay. Now don't let me push you down. Any pain?
No.
Good. Okay. And relax. Let me try one more time. Good. And hold here. And don't let me push you down. Okay. A little bit harder to hold that out. That's okay. So she went down pretty easy. Her scapula moved pretty quickly when I applied resistance to derotate her. Okay. Now let's get you laying down. Would it be easier? I'm trying to think which direction to have your head. What's easier to have her head down here or this direction? Okay. Are you okay? All right, lay down for me. On your back. Sorry. I'm actually going to put one pillow here. Are you comfortable here?
Yes.
Your neck? Okay, so just relax. And bend your knees for me. How's your pain in this position?
It's okay.
It's okay?
Yes.
Is it just okay, or are you having a little bit of symptoms? Tight. Let me get another pillowcase here. Oh, thank you. So I just want to see, relax right there. How does that feel?
Good.
Better?
Yes.
Okay. And relax. I was going to do the lats test first. Well, I can do this. So I'm going to test the length of her pec minor because she is tilted forward here. So just, any pain with that? So she is resting greater than an inch off the table, but I can get my fingertips there. So maybe just a stiffness problem rather than true shortness. There's the pain coming back up. Okay. Yeah. Let me try the other side. That one moves a little bit easier. Yeah. And no pain there. So she's still resting a little bit off, so stiffness, but not the true shortness. And I can get this side down a lot easier than the other side, for sure. Okay. So now I'm going to take this away. So now have your palms up to the ceiling. This way, yes. And then what I want you to do is go like this for me. Yep. Any pain with that? At the top? Okay. And then come back down. So now I'm testing her lat length. So I wanted to see first the stiffness, if as she raises her arms up overhead, if she has any flaring of the ribs or if her back extends. So try to do that one more time. Shrug a little bit as you get to the top so it doesn't hurt. Does that feel better?
Yeah.
Okay. And her ribs do flare a little bit. Okay, and relax. So the first time it hurt her, so I told her to just shrug a little bit to give her some more space, and she said that made her feel better. So that kind of gives me a coin in the bucket for the depression diagnosis. Okay, so now I'm going to restrict her ribs flaring and see how short her lats are. So you just relax and let me do the whole thing. Any pain with this? There. Try to relax. And it's not wanting to go any further. Does it feel like a stretch at all? Yeah? Okay. And relax. So she's a little bit less than 170, so short, but not too bad. Okay. Sorry, I have to get in on your scapula. So now I'm going to test the length of her scapulohumeral muscles. So I have my heel of my hand on the scapula, and I'm watching to see if it protrudes more than about a half an inch, and then I'm going to block it to see. So it comes out pretty early, so it's already moving. You doing okay?
Mm-hmm.
And that's about all she gets, which is a little bit less than the lat length, I would say. And then if I immediately rotate her, she still doesn't go down any further. Does that hurt? Still? Just like a little bit of a stretch discomfort? Or okay. So that tells me that our scapulohumeral muscles are short, so those lateral rotators. So that kind of goes along with the anterior glide, because if those are tight, it's going to push them forward. Okay. I just want to see the other side too. Just to compare and relax. Okay. This side goes down, no problem. Mm-hmm. Right about there. So this side goes down lower too. Her scapula is just starting to move there.
Her right one has better aim.
So I would say her right side has normal length. Okay. So now I'm going to test the length of her posterior delt and posterior capsule. So just relax for me. Let me know if this hurts. Any pain with that? Just a tad?
Right there.
Yeah. And she's not getting quite past her nose either. Pain there? Okay. Let me try this way. Any pain with that? So shortness of the posterior delt too. Okay, and relax. Relax down here. Oh, there we go. You get some ice cream after this. Okay. So just relax your arm on this. Alright. Let me move this over here. So now I'm going to test the length of her medial and lateral rotators. There. You guys need wider tables. Here. Okay. So what I want you to do is just let your arm roll down like that. Go ahead and go down. Any pain with that? So where at? In the front? Okay. So what if you squeeze your shoulder blades together just a little bit? There you go. And then do that motion as you go down. So a little bit. Okay, so when you squeezed, you kind of went down a little bit, so relax your arm. Relax. Just squeeze and just bring them together in the middle, and don't try to go down, down and in. Just go in the middle. Go ahead and do that one more time. Better. So the first time she's corrected her position, she brought her shoulders down in depression and adduction instead of just the adduction. So I think that kind of increased her symptoms. Try one more time, just to make sure. So not, wait, hold on. Not down and edges together. There you go. There you go. And just spin, yeah. And then come back up. Better? Okay, and then now let me see the length here. So you just relax. So just relax. Let me know if you have any pain. Okay. Any pain with that? Can you go the opposite direction? So now let your arm come back. There you go. And come back up. And go again. Go ahead and go again. Any pain with that?
No, just feel the stretch.
One more time. I think this one actually looks kind of okay, like pretty good. Yeah. Okay, and relax. So more of just the anterior glide with the medial rotation is what I saw. And I'll do a little test for the superior glide, so just relax your arm. So here. Any pain with that?
No.
So she does on this have a little bit of a superior glide because she's not spinning right through this axis. She's coming up a little bit, yeah. No pain with that?
No.
Okay. Alrighty. So go ahead, flip over to your stomach for me. I'm going to get you actually 2 pillows here. So lay on this pillow like this. Sits under your chest, yes. Do you want me to move your phone for you?
Do you want to hold the pillow?
No, so you just lay down flat on it. Yep. Yes. So scooch forward just a little bit, if that's okay. To cover. So put your head down here, scooch forward, just. It's not like 6 Flags.
I'm here.
Okay, and relax. So now I'm going to kind of do the same thing that I did in supine and prone here. So lift this up just a little bit. How do you feel in this position? Are you okay? Is it comfortable? Is your shoulder comfortable?
Yeah.
Okay. I know she's being good. Okay, so what I want you to do is just lift your fingers up like that and then go back down. And then go back down. Yep. And do that again. And then come back down. Any pain with this? So she's getting a lot. I'm looking to see if her scapula moves at all. So, and I am getting that she's getting a little bit. Okay. And then come back. So what I want you to do is lightly squeeze your shoulder blades together just a little bit. And then keep your arm resting on the table and act like you have a rod spinning through your arm and just lightly spin up with your fingers. So just lightly lift your fingers. and then come back down. Does that feel any better? A little bit better? Okay, and then try one more time. So now I'm checking to see if she's dropping down too, and then come back down. So I'm noticing you're kind of lifting off my hands here. So stay here. Okay, so go again. Yep, lightly squeeze, and then come back up. So yeah, she is popping up superiorly a little bit on this one too. She's coming down like that. So squeeze, so just relax. I think you're trying to work too hard. So don't force it. Try not to use these muscles. Just squeeze a little bit back here. Yep. And use these guys right here. Just lightly lift your fingers. And then come back down. How does that feel? Better? Okay. And then come back down. So once you feel this start to move, just try to spin right on this straight line. So try to do that one more time. Yep. And then come back down. Okay, now go the other direction. Any pain with that? And again. So don't lift yourself off the table. Yep. So try to relax right here. There you go. Don't lift off the table, just spin. Better. And then come back down. So that looks a little bit better too. Okay, and relax. How did that feel? Better? Okay. Are you just saying that?
No.
I told her if she was still having pain halfway through, just say that she started to feel better. I'm kidding. And she gets ice cream. Now you're fine.
The whole point of that was you saw the anterior, and you're going to turn on the focus on her right anterior.
Yeah.
Just getting her in a plane of stabilization.
Mhm. Yeah, and it did provoke a little bit of her symptoms too. Oh, thank you. Yes. So those would support the anterior humeral glide. Okay. So just relax. And now I'm going to test her lower trapezius and her middle trapezius. So just relax for me. So the muscles I want you to use are down here, okay? So I'm going to do her lower trapezius first. So just relax. Let me know if you have any symptoms with this. I definitely feel the fight of her pec minor here. Okay. So hold right there for me. Okay. And don't let me push you down. So she's already falling out. So relax one more time. It's okay. No, it's okay. So these guys right down here. So let me place you though. So you just relax right now. Relax. There you go. And hold right there. And her scapula just kind of falls out of it, so she's not able to hold that position. But it was a good effort. Yeah. Any pain with that? No. Okay. What if you did that by yourself? So just try to lift your arm up by yourself. Yeah, and so I'm just seeing a lot more post-delt. Sorry, that's okay. Post-delt and rhomboids there. That's okay. I just wanted to see because you said that hurt you before. So I'm trying to be mean. So just relax.
Yeah, Tony, you trained her already.
So just relax, relax, relax. And I can see her guarding too with her rhomboids. So relax. Okay. And hold right here for me. And I'm seeing, okay, so relax. So I saw a lot of these guys and a lot of this and this coming forward. So a little bit of a superior glide there. Okay, so try one more time just with these. So I'm just moving your shoulder blades. Okay, and now hold there. That actually looks better. And then, but as I let go, then she falls out of it. But that was good. You were able to find them.
Yeah.
There's hope. There's hope. Okay. Go ahead and get on your hands and knees for me, please.
I have tears too.
So, hands and knees for me. Does that hurt? Do you want a scarf?
My scarf? We can do a scarf. Wait, make it a little longer.
Put it in your bra.
Yeah.
Here. Yep. How is this position for you?
Don't ask me to do a push-up.
But does it feel...
Duck.
I won't ask you to do a push-up, but does that feel good, bad, same? Same. Okay.
I feel that the left is struggling more than the right.
Mm-hmm. Yeah, and her left, she's using her rhomboid a lot more in that position, even though I just touched her and then she relaxed.
Yeah.
You little
Like
cheater.
I feel that it's more rounded up.
Yeah.
On my right side.
Mm-hmm. Okay. So go ahead and just show me how you would rock back onto your heels. Any pain with that? No? Okay, do that one more time. Let me know if you need a break coming off of your wrist too. So I kind of, there's pain there?
Yeah.
Okay.
It's going from here up.
Okay. And then come back. So are your wrists okay?
Yeah.
Okay. So go ahead and I actually want you to widen your hands just a little bit. So since she's so abducted with her scapula, I wanted to try to widen her hands because that kind of helps facilitate that adduction there. And then get your knees underneath your hips. There you go. And then drop right here a little bit. So drop it down towards, there you go. And tighten your tummy. Keep your chin tucked. So they're like, I'm going to pie you in the face. And then go ahead and push through your hands and rock back. So hold on. Don't let this round. There you go. So now push through your hands and try to go back. Keep that chin tucked. Keep that chin tucked. Yeah. And come back better. And I'm noticing that she's going into that extension as she has a better shoulder position. So try to tilt it. There you go. So now try to hold that neck position as you go back. So push back, push back, push back. And I like this exercise too because pushing through her hands helps the humeral head kind of glide a little bit better as well. How does that feel?
Way better.
Okay. Now you're really just saying that. So do a couple more of those and see if you can keep that neck position. So this would be the first exercise I think I'd send home with her too. Because this looks really good to me. Good. And then come back up. So kind of at here, lightly squeeze between your shoulder blades. There. And then come back. And as you go back, kind of let your shoulders come up just a little bit. So kind of like when you're shrugging up at the, but you have to keep your chin tucked though, as the, there, yeah. So keep that neck nice and long in the back, but then kind of let your shoulders come up to your ears as you go back further. And how does that feel? A lot of concentration. Do you feel stretch at all when you do that? Keeping your chin tucked? So don't let yourself come up. Keep the neckline. Yes. And then come back up. Okay. So that would be, you can sit up. Yeah, so if I had to come up with like one MSI diagnosis, I would do the anterior humeral glide, just because that seemed to be the most provoking of her symptoms. And then also the depression. And I think some of her pain has been because she's been trying to correct her positioning and posture, but she's going just a little bit too far down. So then when she goes up, and tries to do activities, she's not getting as much elevation as she needs, which is why I think that exercise is a good one for her, because it's kind of working on all of the above, right? So that's number one. Number two, I would have you practice laying down and getting your shoulders in the good position and going in and out. So working on that rotation without your shoulder coming up or forward on your back. And then what's the biggest activity that you have problems with at home or at work? When do you get the most pain?
The constant reaching forward.
The constant reaching
Well,
forward?
here at the desk, we're constantly going like this. And our positions we're not the greatest seats there.
Yeah.
But now that I'm in the middle seat, it's a little bit better. But when you sit at the either end ones, you're constantly reaching opposite. So one side gets more than the other.
Okay. So try sitting. You can scoot with your feet over the side. That way you're not. Okay. So go ahead. And let's work on bringing your shoulder blades together. So not as far down, just kind of back. There you go. And then reaching for something with your thumb up, because that seemed to be another thing. And then also allowing your shoulder to kind of come up. How does that feel?
Good.
Better?
Better.
Worse or the same?
Yeah.
Oops, so squeeze. So squeeze back here. And then lightly squeeze back here before you come back. Did that feel better?
Yes.
So then I think also at end range, she's regaining her position, and then as she goes to come back, it just pops forward a little bit. I think that's part of it, so try a couple of those. So squeeze back here. So I'm having her, she said reaching for things at work is bothering her, so I'm just having her practice finding the position and then reaching up. Yep, and then lightly squeezing back here as she comes back. Do you feel a difference with that?
Oh, yeah. Because I have the dominant left hand, everything is reached with my left hand versus my right. So even at home, I'll reach with my left for something.
Yeah.
Not my right.
And then also, too, with that anterior humeral head, I would, when you're sitting in the office, just making sure that your elbow's more in front of you versus having it rest back here at any time. Or if you're laying in bed, just having it propped up more in this position than having it back there. Does that make sense?
Yes.
So kind of like when you were laying on her back and it felt better with the pillow, just keeping yourself out of that. Does anybody have any questions?
What's your prognosis?
I feel good.
So the question is, what is my prognosis? And I would probably give it 6 weeks. 6 weeks if you're diligent with your posture and your exercises.
I failed already when I went
Yeah. So any other questions? How do you feel right now?
I feel
Excellent.
3 scoops of ice cream came my way. I feel good. Kristen did well. Very good therapist.
Yes. The quadruped, supine rotation, and then just practicing reaching for things with better position. Yes.
That's right.
Yes. Mm.
I do, but I do not have them elevated. Mines are at their regular position. Yeah, because I sit, but I know I go like this.
Mm-hmm.
Yeah. Because I'm used to, I don't know, I put the armrest so that it feels here, but not, so I should be here. I'm like this. Right. It's natural. Yes. It goes that, it just goes. Maybe do something so you don't slide back there.
I was curious if, let's say Danielle is a believer now and she does all her homework assignments, she comes in, what would be the progression when she comes back?
So for Danielle, I would focus on once she got the control in this range, I would have her actually strengthen her subscapularis because that kind of usually helps the people with the anterior humeral head. And then I would also have her do wall slides too, practicing getting some lower traps, so wall slides with the lift off to work on strengthening of her lower trapezius exercises. A lot of it, though, with the functional corrections, I think that she'd make progress in that in itself. Just focusing on those all day.
What was the question you asked again?
What progression? How would I progress her exercises? Mm-hmm. Mm-hmm.
That's right.
Mm-hmm.
That's right. Every day I have to do this one.
That funny therapist behind you going, did you do your exercises?
Oh, goodness gracious, do I ever. Edie, you can't just come to the other side just to make sure I'm doing my exercises. My window will always be closed. Yep. Good job.
Thank you.
Thank you.
I hope so. There you go.